Hi, it's Jennifer again here at Indiana State University studying for my BSN. Been an LPN for over 20 years. And today's lecture is about COVID and the COVID quarantine. What should we do if we suspect that we've been exposed or if we have been exposed and have a positive diagnosis of COVID-19? We are all at risk here, and so we all need to take precautions. Coronavirus is not new to us. It's been around for many years. Just as there are different strains of the flu virus, there are different strains of the coronavirus. And back in 2002, 2003, the original strain caused the SARS, or the Severe Acute Respiratory Syndrome. Then in 2011, along came another strain responsible for the MERS, or the Middle Eastern Respiratory Syndrome. And then, as we all know, in 2019, COVID-19 came along. And research continues daily. We are learning new things about COVID-19 and how to combat this virus. The COVID-19 virus, the incubation time is usually 5 to 14 days. Now, you can be exposed one day, and it's not going to come out the very next day. The typical time for coming out is 5 days, but it could take up to 14. Testing is usually done with a swab that's inserted into the nose, just as the flu swab is inserted into the nose. However, the flu swab doesn't have to go quite as deep as the COVID-19 swab. The COVID-19 swab has to go way, way back into the nose, and it's not the most comfortable test. Infection control. It's very important that there are processes in place that screen to prevent sick employees from coming into work. So a lot of facilities are taking temperatures at the beginning of the shifts and throughout the shifts. Because what we're finding is that there are a lot of employees that don't have enough paid time off available, which means if they don't work, they don't get paid. So they may try to mask or hide their signs and symptoms in order to continue to receive their paycheck. Social distancing is still very important, 6 feet apart. And masks, this limits the droplet spread. But it can't just be a one layer, any kind of mask. It has to be the appropriate thickness. And the recommendations at this point are 3 layers thick. Frequent hand washing, at least 20 seconds. Some say to sing the happy birthday song while you're washing because that song lasts about 20 seconds. Or you could choose one of your favorite songs that last about that length of time to sing that while you're washing your hands. Sanitizing surfaces often. This is very important because there are door handles, doorknobs, elevator buttons, the chairs in the lobby. All of these things are very contaminated surfaces, so it's important to wipe these surfaces down often and sanitize them. So what are the signs and the symptoms of COVID-19? Well, the main one has been a fever. Out of people who are infected, at least 88% of them will develop a fever of 100 or above. Shortness of breath is also one of the main symptoms. Fatigue, body aches or muscle pain, headache, new loss of taste or smell, a sore throat, congestion or runny nose, nausea, vomiting, diarrhea, and the newest one added to the list is a rash. And what we're noticing is a lot of times this rash begins on the toes and then works its way up the body. So what do you do if you've been exposed? Well, you self-quarantine, you go home to start with. Now, at this point, there's no research that states that we can transmit the COVID-19 through our pets. But since COVID-19 is still so new to us and we're still learning, It's a good idea to stay away from the pets also, just to be on the safe side. Then notify your doctor, keep your doctor in the loop, let them know everything that's going on, and monitor your temperature. If it gets above 100.4, this is cause for concern, especially for an adult. Open the curtains to let the sunlight in because COVID does not thrive in the sunlight. And if it's a decent enough day, then even opening the windows would be recommended to get some ventilation and some fresh air in. Try to drink plenty of water, no alcoholic beverages or drinks that are full of caffeine because these can dehydrate even further, so water is recommended. And try to eat as healthy as possible to give your body enough nutrients to be able to heal. So if you're at home in quarantine, when do you seek medical treatment? Well, if you have severe trouble breathing, or if you have a pulse oximeter, that's the device that goes on the end of the finger, and it measures the oxygen saturation in the blood. If that goes below 92%, it's time to seek medical treatment. Or if you have chest pain or pressure that just does not let up, confusion, inability to concentrate or to stay awake, or if your lips turn a bluish color, it's time to go to the hospital. So when can you get back to work and your regular activities? Current research says that you can go back 10 days after the symptoms have started, plus 3 days without any symptoms. Or if you've had a positive test result without any symptoms, you can go back 10 days. As we said earlier, sanitizing is very important. We can use 1/3 cup of bleach per gallon of water. There are also different recipes for alcohol solutions, but those have to be at least a 70% alcohol solution to start with. And the Environmental Protection Agency, they have a website and they have a list of the certified cleaning ingredients along with some other recipes for your make your own sanitizing products. And make sure you sanitize all the frequently used surfaces often. And current research says that regular laundry soap is sufficient to get the virus out of the clothes, but try to use the hottest setting possible. Now here in Illinois, there are a lot of resources and people on the other end of these phone numbers that can help you. Many different people are eager to help. These are hard times, and there's no sense in being too prideful to give somebody a call if you need help. So please utilize these numbers if there's anything that you need. I thank you so much for listening today, and I hope you have a great day. Bye-bye.